Okay, what have we described so far? Today, we were talking about the muscles, this group of muscles, which are the lateral rotators. In here, in this one, you can see the piriformis and the two gemellus, two obturators, and the quadratus femoris. We also describe the gluteus, the maximus, the medius, and the minimus as the gluteus minimus and medius as abductors and gluteus maximus as the major extensor at the hip. And we described, or not here, but the group of the posterior muscles of your thigh, which are the hamstrings, the posterior compartment. The previous class, we also described the flexors at the hip and flexor of the trunk. We described the anterior and the medial compartment of the thigh. So we have described so far the hip and the thigh muscles. In next class, we only need to describe the leg muscles. So I just want to show you this to see that you know all of these muscles, how much you have learned in these two classes. And in here, I'm just going to label and identify. If you need to review the actions and the innervation, go back and check that. Okay, so anterior view, right, of the thigh. So we said that this one in here, that's your sartorius, right? And the sartorius is like your landmark, your point of reference to divide the anterior from the, in here, the anterior from the medial compartment of the thigh, okay? In the anterior compartment, the most superficial muscles, the ones that we can see in here, well, we can see the rectus femoris. This is the vastus medialis, the vastus lateralis. We can see the quadriceps tendon. Down there, the patellar ligament. We can see this is the tensor fascia latae. This is your iliotibial tract or iliotibial band or IT band. This group of muscles in here are, this one is the iliacus and the medial one is the psoas major, okay? Then we can describe the abductor muscles. This is the pectineus, this is the adductor longus, and this one is the gracilis, okay? So I'm gonna turn this to the medial side, medial view. What can we see in here? Where, well, we can see again, let me turn it a little bit because I'm still, okay, this is more medial. Okay, so this, again, let's identify our point of reference. That's sartorius, which means that this is rectus femoris and this is vastus medialis, right? This is gracilis, the long adductor of the thigh. And this is adductor magnus. Remember that extends from pubis to ischium. Which muscles of the hamstring can you think is this muscle and this muscle? They are located towards the medial side of the thigh. So this one is the semimembranosus, the medial one, and this one is the semitendinosus. In here I can see the gluteus maximus, and you notice that obturator, actually, that's the piriformis, and this is the obturator internus. Yes, because it's towards the medial side. That's obturator internus. Let's look at the back, the posterior surface, okay? In the posterior surface, again, I can see gluteus maximus, the IT band. I can see the hamstrings. So remember, next to the IT band, see? Next to the IT band, which is this one, I'm going to see the biceps femoris. Now, which one? Well, this is longer, so that might be the long head. The short head is there. Can you see it? Is deeper than that. This one in the middle is tendinosus, semi-tendinosus, and this one towards the medial side of the thigh, that's semi-membranosus, and that's an M, just so you know. Okay, let's see. Let's rotate this so you can see now the lateral side. Lateral side there. Again, we can pick gluteus maximus, IT band, tensor facial lata. See, we're turning all of this. Again, rectus femoris. This is now vastus lateralis. IT band, this is lateral. So this is biceps femoris. This is the long head. You can see in here, this is the short head. Lateral to that, this I will say is semi-membranosus, and this is tendinosus, and this is semi-membranosus, and that's it. So we have learned all of these muscles, guys. Not just that, but the ones that are deeper to that. So let's review then the movements that we have learned so far. We have described the movement of at the hip, so that is flexion of the thigh at the hip. This is extension of the thigh at the hip. Then we have abduction of the thigh at the hip, adduction of the thigh at the hip, medial rotation of the thigh at the hip, and the lateral rotation of the thigh at the hip. Okay, now look and compare, especially the rotational movements. I want you to see how different they are. In here, you're moving the hip. Now we're going to describe the movements at the knee, okay? And I want you to pay close attention to medial and lateral rotation at the knee. See that the knee is moving and not the hip joint. Okay, so first, flexion of the leg at the knee, hamstrings, extension of the leg at the knee, quadriceps. Look at the medial rotation and the lateral rotation. How subtle that movement is. It's just to lock and unlock the knee as you walk, when we're walking. Now, in total, what are the muscles that we discussed this class? All of them. We described these 4 movements and these nerves. We mentioned a little bit more nerves than any other classes, but still very easy. So, which one are the muscles that are extending the hip? So the prime movers, remember, are gluteus maximus and all the hamstrings, because they're crossing posteriorly the hip joint. The rest, they are crossing posteriorly the hip joint as well, but they're synergists. They're not prime movers. Now, what else? Let's see. All the muscles that can abduct the hip. Who can abduct the hip? Especially gluteus medius and gluteus minimus. This is the medius. When you peel that, you cut that, you can see minimus underneath that or deeper to that. All the adductors, this is the abduction, yes. All the lateral rotators of the hip are synergist to the gluteus medius and gluteus medius and minimus, okay? So here you can see the medius, the minimus, they are abductors, but they are synergist to the lateral rotation. And the lateral rotator groups are synergist to the abduction, to gluteus and gluteus medius and minimus for the abduction of the thigh at the hip. Lateral rotation, all of these muscles, P go Q. So piriformis, gemellus superior, obturator externus, gemellus inferior, obturator internus, obturator externus, and quadratus femoris. Okay. What else? Okay. Remember, gluteus medius and gluteus minimus are synergist for lateral to the lateral rotators of the thigh. Now, what else? Flexion at the knee are brought to you by who? The hamstrings. They're the prime movers because they're crossing posteriorly the hip joint. Okay, so the hamstrings, the biceps femoris, semi-membrane tendinosus, and semi-membranosus, they're the prime movers of flexion at the hip. So they're in black, extension at the hip, and in cyan, they are also flexors at the knee. I didn't mention this, I didn't include this movement in here, but biceps femoris is the one performing the lateral rotation at the knee, and the semi-membranosus and semi-tendinosus are the one performing the medial rotation of the leg at the knee when we are going to unlock the leg from the extended to flexed position. Okay, now the nerves. The nerves, very easy. Superior gluteal nerve. Let me go back really fast to erase all of that. Okay, superior gluteal nerve. Superior gluteal nerve, it innervates the gluteus medius and gluteus minimus. Remembering here, we're going to add the tensor facial lata that is anterior in here. Inferior gluteal nerve, only one muscle in our list, which is the gluteus maximus. Now, the piriformis, easy, just the piriformis, the lateral rotator. The obturator nerve, well, we know innervates the medial compartment of your thigh, about here, well, the gracilis and all the muscles in here. This is the adductor magnus. But from this list, the obturator externus, okay? L5S1 is going to innervate the rest of the lateral rotators, which is obturator externus, both gemellus and quadratus. And last but not least, let's describe, I'm gonna get blue again, I'm sorry. But the sciatic nerve, remember that it branches into the tibial nerve and the common fibular nerve. Okay, so the tibial nerve innervates all the hamstrings, and you can say it right now, all the muscles of the posterior aspect of the leg, except one, which is the short head of biceps femoris that is innervated by the common fibular nerve. Okay, that's it. Now, in the next video, we're going to describe the anatomical landmarks, the surface anatomy landmarks, and that's it. See you later. Alligator. See you.